Hi everyone. I would like to thank HIV AIDS 2014 for giving me the opportunity to present my paper on Is Mental Depression a Serious Issue Among Female Sex Workers? Evidence from the Southern India. This study is basically a behavioral study. So first let me introduce to the what are the context of sex workers in India. So most of the sex workers are either forced to the sex work or they join the sex work by their background, by poverty or pushed by the financial debt, or either by the trafficked into the sex work, and their mobility for the sex work, whether intra-districts or inter-districts, is relatively high. So in words of the mobility, they usually indulge in high-risky sexual behavior, as well as they may face violence, either it is physical violence or sexual violence. At the same time, there is social discrimination as well as stigma also attached to their works, and their working and living environment also being operated by many stakeholders, just like we can say the madam, brokers, even sometimes with the police of the local police also involved. And there are lacks of supporting policies in terms of their financial as well as their social security. So the rationale of the study, we can say mental health is an important issue, and global burden of disease study also, it reflects that consists of 13% of the total disease burden. And the lifetime prevalence of mental health disorders in India is nearly 12%. But so far, none of the only one study so far I have gone through, and none of the other studies has been cited which give a reflect on the female sex worker mental health or other high-risk populations' mental health status in India. So I thought the study will give some focus on Indian context, which can lead to the future research. So my objective of the study is to understand the prevalence of major mental depression among female sex workers in southern India, examine the factors associated with the major depression among female sex workers. So this study is a cross-sectional study, and this is behavioral tracking survey conducted in 2010, and the 1986 female sex workers had been interviewed in some selected districts of Andhra Pradesh in southern India. So the depression has been assessed using the patient health questionnaire PHQ-2 scales, and we have used this score of 0 to 6, and then we have divided into two categories, major depression and no and low depressions. And we have used also some descriptive statistics as well as multivariate analysis, logistic regression analysis for the major depression. So the background characteristics we can see here, the mean age is 29, and 64% of the sex worker main place of solicitation is your public places or street-based sex work. 85% are currently under financial debt, and more than 11% have faced any physical violence reported by them in last 6 months. So the PHQ-2 scale has been used here to measure the mental depression index. So the two questions has been asked to the female sex worker. So in the last 2 weeks, how often have you been experiencing little or no interest or pleasure in doing things? And then how often have you been experiencing feeling down, depressed or hopeless? And 4 answer has been given. So combining both the questions, we have constructed this mental health depression, that is your score ranging from your 0 to 6. Then we have given greater than equal to 3 score is major depression, and less than 3 is your low depression. We have fixed these three. I have gone through some literature also based on this. As some of the study, it mentioned that the positive the higher false positive cases will be reduced if you fixed at a 3 score. But if you fixed at other scores, then the sensitivity as well as specificity of the score will this value will increase. So we have fixed here the score of 3. So based on the multivariate analysis, we have analyzed, and then who are the likely to report major mental depression among female sex workers? So those who are living with non-family members, those under financial debt, those sex workers who are mobile for the sex work within the districts or beyond going to the other districts also, and those who have arrested by the police and who don't want to report their HIV status. Unfortunately, we have not significant association with this physical violence in last 6 months. Although the pattern there is it is showing a positive association, but result is not significant here. So the summary and recommendation, the study cites a significant proportion of female sex workers have reported major mental depression. So sex workers' financial vulnerability and sex work context are significantly associated with poor mental health. So with the financial security, social security, and creating an environment at local level should be prioritized to improve the mental health among the marginalized group, that is your female sex worker. And HIV prevention intervention programs should also include the mental health counseling as part of their program to build the self-efficacy in the short term and achieve a healthy community for the longer term. So we would like to thank Avahan, the AIDS India initiative, for their support for this study. Thank you very much.
Yes, question?
Thank you very much for your presentation, Artist Mo from UCLA. I was fascinated by the link between debt and depression. Can you comment on the link between debt and the fact that they were sex workers? Did it have any link to them becoming sex workers, the amount of debt they had?
Financial debt they have, because in this study we have asked whether you have any financial debt in the past or currently do you have any financial debt. So they have answered that yes, they have a major percentage have reported that they have financial debt. So due to the financial debt, they have entered to the sex work to support their family, to support their daily living standard, all these things.
Yes.
Hi. I also found it very interesting that 90% or so of the sex workers were married, or sounds like had been married. My question is about women who are not sex workers. About what would the comparison be? How, if you were to look at depression among women who are not sex workers, what would the prevalence be in this area?
This study is only conducted among the sex workers.
Right.
We have not considered because those we have our objectives. Study objective was not there.
Right. I understand. Are there other studies that have looked at this question among women, the general population?
General population, the lifetime risk I have mentioned in the rationale of the study that it is nearly, you can say, 10 to 12%. In their lifetime, they have anytime they have replied that they have depression, face depression in their lifetime. Within the female sex workers, we can make, but in this study we have not considered. But in future study for publication, all the things we can consider suggestions.
Thank you, Dr. Patel. Thank you very much.